Hey, how's it going? My name is Jeff and I'm the OT dude and I'm a licensed occupational therapist practicing in the United States. And today I'll be going over how to brush your teeth, or at least tips that I've kind of learned and taught patients after stroke in which you may have one-sided weakness for your body. And brushing your teeth at the sink is a great way to work on a lot of skills and physical ability and then cognitive mental abilities as well, because it works on things like standing balance. Of course, with one-sided weakness, it works on using both hands really. It also works on other skills too, such as your vision, looking in your environment. Some of you may know after a stroke, you may have kind of like a decreased awareness, such as ignoring the left side of your world. Brushing your teeth is a great way to work on something that's really functional that you need to do every day, right? First thing is, how do you get to the sink? Two common ways is if you roll up there in a wheelchair. I'm in kind of like an Airbnb right now and there's like a lot of space. And if you do not have space, then you may want to consider rearranging your environment so that you do have space, or finding another safe space that is close enough to the sink so that you can do that. Of course, that depends on your situation and everyone's environment is different. But for most of us, the goal, at least in therapy, is to have patients be able to stand at the sink. So that may be using things like a cane, for example, to walk to the sink, or just walking with some support, such as wearing a brace. And one great thing about brushing your teeth, at least standing up, is that you can work on standing balance using your kind of your surfaces and your environment for support. So here, for example, if I brush my teeth right-handed, for example, I can use my left hand for support. So what are some common issues and difficulties with brushing your teeth after a stroke? That may be one-sided weakness. So I'm gonna kind of mimic that with like my hand and my leg as best as I can. So one thing that you can do is you kind of use a sink to brace, like using your body for balance. If you want to make it a little bit more difficult and kind of work towards a more independence, and goal of what you were doing before is not having the support, using kind of like the sink as support. So what you can do is kind of practice by leaning against it and then gradually doing it less and less and using it so that you have a gap basically in between yourself, like such as your thigh and like the sink edge. And of course, if you're ever going to be at risk for losing your balance, grab onto something, right? We don't want to have you have it fall. So brushing your teeth, to have everything within reach. So even before you start to brush your teeth, have yourself or a caregiver help you set up the environment. So the supplies that you commonly need, for example, of course, are the toothbrush and your toothpaste, being able to reach the sink, and maybe like a hand towel, which I don't have. I'll just use toilet paper here for standing in today. Basically, there's two schools of thought in terms of which arm should you use in terms of doing rehab and recovery. Kind of like the old school mentality approach is, well, your right side, you can't really do much with it. And the old school kind of approach is to just compensate by using your more stronger working side. So that would be my left side, in which you use everything with your left arm if I had right-sided weakness. But nowadays we kind of use a approach of more doing what you can. So if I have some movement with my right arm, the brain is really able to quickly adapt and learn and recover, what we're seeing in terms of recovery, like with things after a stroke. And there's gonna be kind of like a spectrum of ability of recovery, right? From the very end of not being able to learn anything at all to the opposite end of being able to learn and recover almost basically back to independent and doing what you were able to do. You could fall anywhere along this continuum, from the extreme of not being able to do anything at all to doing everything that you were able to do. So with that in mind, I highly encourage you to use your weaker side, so to speak, as much as you can, even though it may be very difficult, very frustrating, and it'll require a lot of patience. It'll take more time, both for you to do something as simple and routine as it once was as brushing your teeth, as well as patience of like your caregivers, those who may be around you and helping you out. Because using the approach of just compensating, ignoring the side that was affected, basically you give no chance of having that side to recover. You're just doing everything using the opposite side of the brain. And what we're seeing in study is that even in as little as a couple minutes, the brain and its ability to learn and how it does things routinely changes really, really quickly. So even with things like after a stroke, if you were to, for example, start ignoring this side and just start doing things because this side works, like my left arm, then it kind of gets worse and worse, so to speak, for the right side. And it's almost as if like this side of your body is foreign to you and it doesn't even exist to your brain. So with that in mind, I'm going to try and do a little bit of both. I'm going to use both hands because, you know, in real life, a normal person, so to speak, uses both sides of their body, right? If they have both working sides, they're going to use their left hand and their right hand. When you brush your teeth, like normally, so to speak, you use your left hand. You may be like just kind of leaning here, brushing your teeth, or you may be like checking your phone with your left hand and brushing your teeth, whatever, right? I guess if you don't get anything from today's video, my tip is to basically remember to try and use all sides, all parts of your body as much as you can and try to give it a job. Even if it's as simple as, if my right arm is weak, using it to kind of like bounce and like hold myself steady while I use my left hand to brush my teeth. Or if my right hand is working, but it's really, really weak and my left hand, you know, is normal, then I would use my left hand to balance as well. But if I can't like reach here, well, maybe I can like lean against the sink, for example, and like kind of help myself brush my teeth with my working hand, and kind of like a helper. So those are just some general concepts. So now let's get into it. When you brush your teeth, what's the first thing that you usually do, right? Probably get your toothbrush. Scenario one is your hand works pretty well, but it's kind of weak. So it may be, for example, unable to grip a toothbrush because you may not have a firm hand grip and maybe kind of like slip out of your hand. So one tip you can do is kind of thicken up your toothbrush. And I'm using my kiddo's toothbrush here, which is kind of like small and skinny, but even still, the great thing about electric toothbrushes is that they're kind of built up and they're thicker compared to like a regular dumb toothbrush, so to speak, not electric, and it would be thinner. So if you're using a normal toothbrush, so to speak, you can kind of thicken it up using things like rubber bands or like, oh, I don't know, like towels, and then tie it around and wrap it around and then tie it with rubber bands to make it thicker so that you don't have to grasp as small as a cylindrical shape. So you can just have kind of like it's like a general grasp. A very extreme example would be like this tube of toothpaste, right? It's thicker and it's easier to grab than something like this. So that makes things like holding objects easier to your advantage. Now, depends on your ability to hold it. If you cannot hold like a toothbrush, what I teach most of my patients is to kind of apply the toothpaste with the object down. Using my right hand for stability and balance, I can just use it to hold onto the sink here, so I'll have it kind of here the whole time. And using my left hand, I can apply toothpaste. So on the subject of toothpaste, these are two commercially available toothpastes, right? And I would highly recommend that you get the kind that's like this red one that has a pop-off cap, because this allows me to easily open up and squirt toothpaste with my left hand versus using something like a twist cap, because while you can do it with one hand, it's kind of like takes more time, and then you have to like worry about not losing the cap. If you don't worry about caps and you're one of those people that leaves the caps off anyways, then this isn't as much of an issue for you. And so applying toothpaste, pretty self-explanatory, right? But trying setting it down, I think, is very, very helpful, so then you can apply it. And then from here, you have the option, say if you want to wet it, just turn it on. And then brush your teeth. And this is an electric one. Like most dentists would recommend, try and get an electric toothbrush because it's number one, less fatigue. You don't have to do as much manual labor and work. And two, because it has a timer feature. So when you're worrying about things like maintaining your balance and just trying to get something as simple, so to speak, as brushing your teeth, but maybe more difficult after a stroke, having that timer function where it kind of alerts you and like vibrates when like it's time to switch off to like your top side, or after like 2 minutes, I believe. It's when you completely have brushed all of your teeth for the recommended amount of time. One less thing to worry about. So I highly, highly recommend getting an electric toothbrush. Pretty much self-explanatory from here. You just brush using this side. Now, if you have pretty good balance, or you can just lean against it. You can use your weaker side, and like I mentioned earlier, use your left hand to bring the toothbrush to you and brush it that way. So what I'm doing here is called hand over hand, and I'm using my left hand as a helper to kind of guide myself and brush my teeth this way. So I can do things like rinse off this toothpaste with this hand, set it down like this. So earlier you saw me use my left hand to hold the toothbrush. Now using the same demonstration of right-sided weakness, if you're the opposite, then this would be the opposite hand. I'm using my weaker side to hold the toothbrush with my right and more kind of functional left, non-affected left hand to apply the toothpaste. So this gives my right hand still a job to do while using my left hand to do some of the quote-unquote more difficult tasks. And I'm using my left hand to turn on the electric toothbrush and then using it to provide support for my weaker right hand. Now I'm holding it in this demonstration with my left hand supporting it at my elbow, but of course if you have even more weakness, more difficulty, you can hold it higher, such as at your wrist or even at your hand. And notice I'm kind of leaning against the counter for a balance, just so that I don't lose my balance. And basically, I'm going to rinse off using my left hand to do more difficult tasks like turning on and off the faucet and helping my right hand to set it back down. Now, if you had a charger, then you would put your electric toothbrush back, setting it back onto the charger this manner. And when I am done, now I am demonstrating how I kind of wipe my mouth and wash up. And my right hand is providing support, that weaker side, and my left hand is wiping my mouth and turning on the faucet and kind of rinsing off. Now I'm going to show you another way to do it basically, which I highly encourage you all to try, in which I use my right hand that's having more difficulty to actually try and rinse off with the water. So I'm using my left hand for support to do what I can't do, in which I bring my right hand all the way up to my mouth to rinse off this way. And from here, basically doing some of the more difficult tasks again, like wiping my mouth with my left hand, but you can also try and do that with your right hand, like two hands together as well. So I highly recommend you all experiment and try different methods. And when I'm done, basically I'm tucking my weaker hand into my pocket so that it's kind of more secure and not just dangling off to the side when I'm finished and I walk away and go do something else. So I hope this helps. Thanks for watching.